In this video, we're going to cover 3 questions. When will my vision clear up after cataract surgery? What happens on the day of cataract surgery? And 3, how long is the recovery after cataract surgery? Welcome to the 3rd video of our series on cataract surgery. I'm Mohammed Al-Mala. First, let's talk about what happens on the day of cataract surgery. On the day of surgery, you will show up to the surgery center. You will have not eaten for 8 hours before the surgery because I do give you IV anesthetic to help you relax during the procedure. When you arrive, you're going to check in with the clerical staff. They will make sure all your paperwork is in order, and then when it's time for you to be called back, one of my nurses will call you back to the pre-operative area. Once you're in the pre-operative area, the nurse will start an IV, and then the nurse anesthetist will come meet you and interview you, and then they'll give you medication in your IV to help you relax. The nurse will also administer eye drops to help your pupil dilate. You'll be hooked up to a monitor which will monitor your blood pressure, your heart, as well as your oxygenation level. Depending on how things are running that day, you will probably be in the pre-operative area for 30 minutes to an hour. Once it's your turn for surgery, my nurse will bring you back to the operating room. Once you're in the operating room, you will meet the operating room staff. You'll meet a circulating nurse, as well as a scrub technician, as well as your nurse anesthetist will all be back there. We will clean around the eye that you're having surgery in, and once that's done, you will be covered with a drape, leaving just the eye exposed. It's important at this point in time that you not reach up or touch around your face because now the area around your eye is sterile. We want to keep it nice and sterile and free from bacteria to minimize the risk of getting an infection. You will hear me speaking with the staff. We will do something called a timeout, where we review the operative plan one more final time before doing the surgery. At this point in time, you'll feel me touching around your face. You'll feel a bit of pressure around the eye. You'll see a bright light from the microscope. You'll feel water periodically, which will be used to keep your eye nice and moist to prevent it from drying. At this point in time, there's really not very much for you to do, but just to sit back and relax. You'll hear noises from the machine. You'll feel water periodically. For about 3 or 4 seconds, you'll feel anesthetic, which will sting and burn for about 3 or 4 seconds. And then within a short period of time, I'll tell you that you are done. We'll remove the drape from your face, as well as the speculum. The drape can be quite sticky, and oftentimes people will feel that that's probably the most difficult part of the procedure, is just removing the drape. And then you'll be taken back again to the post-operative area, where we'll call your family member, whoever is waiting for you, to come pick you up. In the post-operative area, you will also receive instructions about how to use your post-operative drops, as well as all the do's and don'ts after cataract surgery. So what are the do's and don'ts? Do use your eye drops. Do call us if at any point in time you're experiencing a problem or feel like the vision is getting worse rather than better. At the time of this recording, I usually have patients use drops for a total of 4 weeks. The first week, the drops will be 4 times a day. The second week, 3 times a day. The third week, twice a day. And the last week, just once a day. You can also use artificial tears or lubricant drops during this time if the eyes feel dry, or if you're feeling like you're having any minor irritation. If you're having pain that's not normal, then you should call. In the post-operative period, I like to tell my patients not to get any water in the eye for the first week, no swimming for the first week, no makeup around the eye for the first week, no weightlifting or really strenuous activity during the first week. You will not go home with a patch or a shield. Typically, you'll just be given an eye shield to wear over the eye at night, just when you sleep. That eye shield is there to remind you not to rub your eye. For exercise during the first week, you can walk, you can be on a treadmill, you can be on a stationary bike, but really please refrain from weightlifting or doing any activity that involves a lot of jumping up and down, just for the first few days, most importantly. So when will your vision clear up after cataract surgery? The day of surgery, your vision will still be blurred and you may feel like you have something in the eye. That all will get better by the next morning when you wake up. Each day after cataract surgery, your vision will slowly improve. Each day will be better than the day before. If you've had astigmatism corrected at the time of surgery, usually within the first 2 or 3 days, the vision really is quite a bit better. If you still have a lot of astigmatism that was not corrected at the time of surgery, then really your vision will not be, you won't have your best vision until we prescribe you glasses, which will usually be about 3 to 4 weeks after surgery. So now you know what happens on the day of cataract surgery. You know the do's and don'ts of the recovery period, and you know that it can take a few days before the vision clears up after cataract surgery. If at any point in time during the post-operative period you feel like things are not going well or not going right, it's imperative that you call. Don't wait until your appointment, please. If you're having pain or feel like your vision is getting worse, please call. And so if there is an issue, we can address it in a timely manner. See you on the next video where we discuss the different types of lenses you can have placed at the time of surgery. Very important discussion. Did I mention that I wrote a book about cataract surgery and what to expect before and after cataract surgery? You'll find it in the link below. See you soon.